Can everybody see that?
Yes, I can see that.
Okay.
Yes, can see that.
Okay, Sohrab, I'll hand over to you. Sohrab, is that okay?
Certainly. Can you hear me?
Yes, we can hear you.
Yes, can hear.
Okay. Right. Good morning, everybody. It's a pleasure to be here to talk to you about the impact of COVID-19 on the mental health of our population here in Derbyshire. And there's a lot to talk about, and I've only got 12 minutes, but I'll do my best. First of all,
I'm on.
can I just ask you to, Tracy, can I just ask you to make the slide fit the screen? I don't know how you do that, because it's very small on my thing. Right.
Oh, it's big on mine.
Oh, it's big on yours. That's good then. Okay. Right. So that's me. I work in Claycross as a GP, and I work with the CCG to try and develop services for mental health, learning disabilities and autism. And I'm enjoying it very much. And it's a privilege to be able to help not only with the services that we've got now and have had, but also developing new ideas for services going forwards, transforming them. And that's why we really need to hear from everybody what's the way forward. So the next slide, Tracy, thanks. I wanted to start by just sharing with you a perspective on what lockdown and COVID have done to the mental health of our population. In June, so we have to cast your mind back to June, 16,000 people were interviewed by Mind, and they asked them how they felt their mental health was being impacted by the lockdown in June. And what they found was that the majority of people, let's put it that way, said that their mental health was actually deteriorated or worse than it had been before the lockdown. And this was across the board, adults, children, males, females, and it was particularly true in people who'd had a pre-existing mental health problem. So that people who'd had a pre-existing mental health problem were, especially if they were young, had a 75% chance of being worse during lockdown. So this gives us a scale, an idea of the fact that it's everybody's business. You know, this isn't just a few people that we're talking about here, and who to look out for in particular. Could I have the next slide now, please, Tracy?
Has that come up?
Yes. So this slide, I wanted to talk about some research we did in Derbyshire we asked the question of our public health colleagues, well, what's been happening in pandemics around the world in the past? What happens to the mental health of our populations in a pandemic situation? Of course, every pandemic being a bit different, but this research was commissioned by Public Health, and what we found was that there is an increase in mental health or mental illness of about 7.5%. And that includes COVID, and that included, say, the areas of China, where there was originally a lockdown. There was a higher mental illness of 7.5%. And that was due to direct trauma and bereavement, sadly, and also, of course, isolation from people not being able to meet each other on the society that they lived in, et cetera, et cetera. So this does not include any changes that will happen due to the economic downturn, which we are facing as well. A separate piece of research showed that 25% of Derbyshire workers, people in jobs in Derbyshire, their jobs are at risk because of COVID. So that's a large number of people who have an additional financial insecurity. And therefore, the overall change in mental health was more than 7.5%, needless to say. Specific to COVID, if you look at the right-hand side of the slide, it says C19, specific challenges, things that are unique, in other words, actually. post-intensive care unit or ITU unit, if you are lucky enough to survive that, then over half of the survivors have some mental health issue, which would be post-traumatic stress disorder or some impairment of cognition, which is their ability to remember things or think. But nearly half of them don't, which is excellent too. Another thing that's pretty specific to COVID, and you have to go back to the dark ages to probably, see when this last happened, is when people are unwell or sadly dying, they are then being removed from their families, and the families are not able to access them. And this kind of stress, this additional stress to the fact that your loved one is ill or dying, is a very complicated issue, right? So it makes grieving complicated. So people who are very traumatized by that process, is complex grief, we call it. We have seen, unfortunately, and it's the same everywhere in the country, that there has been a rise in the mortality in the high-risk groups, such as serious mental illness, that's what SMI is, LD, which is learning disabilities, and A is autism, and of course dementia. So these vulnerable groups have had a higher rise in mortality since the beginning of COVID. Other things we've noticed because of lockdown, I'd say, is the domestic violence has increased, and due to the fact that people are under additional stress and spending more time in the house. If things weren't right to start with, they're going to feel even worse, and maybe less option for you to seek help, which we're trying to address. The last bit is to say that obviously the vulnerable groups are the at-risk populations. General practice, my job as a GP now is 50% people seeking help for depression, anxiety, and sometimes suicidal thoughts. So I see a lot of that now compared to what I used to do. Next slide, please.
Just to let you know, so I've got about 4 or 5 minutes left.
That's great. That's plenty. So the wider determinants of what makes a difference to your mental health include things like your social isolation. Obviously, people may be more lonely. Certainly, they are more fearful. And we mentioned domestic abuse in some cases earlier. Then another group, people who have got the financial impact or on furlough, and are worried about what they're going to do if furlough finishes. That's another group that we have to think carefully about. And there are those who have poor social, not poor social, but sort of like when they're told to lock down, they have no garden and they haven't got brilliant housing, so, or they're crowded. This is a group which I think are disadvantaged due to social determinants. We know that key workers struggle with the well-being during the COVID pandemic, and I think a lot of key workers are very tired now. There was the adrenaline at the beginning, and now people are finding that they're tired, a bit weary of it all, and wondering how they're going to keep going. So there's some of that. And of course, it's difficult for us to use our usual coping mechanisms at the moment. So, whether you enjoy work or socializing, that's gone. And a lot of people have put on weight. I forgot, COVID has caused people to become a little bit heavier. And also access to services has been reduced. Next slide. I won't talk much about this because I think Dave's going to talk about this, because it's about the changes to services. But we do know that the staff have been unwell, the beds have been reduced, less consultations, which are now going on online. The physical health checks have reduced, and primary care has been using a lot more online and telephone consultations. So that's good. And if I could just spend the last 2 minutes on suicide prevention, which is an area which is really important. It is everybody's business. We all most people who die from suicide, and I hope this isn't upsetting anybody because it's a very sensitive subject, but most people who die from suicide, right, are not under the mental health services. It happens to them outside of that care. You know, they're not under mental health. They may or may not have seen the GP at some point, but they're not. So it's everybody's role to be thinking about how each other is, being aware that somebody who's struggling might be thinking of suicide. Just ask them the question. Just say, is that something that you've thought about? It doesn't make them worse if you ask them the question. I know it might feel like it might, but it doesn't. So ask them the question, and if they say yes, then signpost them. Say, look, you need to go and talk to someone, GP, counsellor, whatever. And I will say that the male to female ratio is 4:1. That means 4 times as many men are going to die from suicide as women. However, self-harm, which is on the increase in young people particularly, is mainly females. So very passionate about this. There's an absolute rich supply of, what's it called, information, videos and guidance for ordinary folk, everyone, not just professionals, to access, is this website I've put on here called stayingsafe.net. And I would recommend that everyone looks at that and makes a safety plan for themselves or anyone they're worried about, to advise them to do that together. And we've just commissioned some support for people after suicide in Derbyshire using the Tomorrow project, which the information is there. So you'll now get excellent support straight after suicide, whoever you are, and it will help you throughout that prayer period because it's a very difficult period. So that's my bit for today, and I'll be around to answer any questions later. Back to Tracy.
Thank you, Sohrab. That's really interesting and very important information on that last slide. Thank you for that. In terms of the chat box, I'm just looking. We don't have huge amounts of questions. I don't know whether we leave them to the end or
we can answer them later. Yeah.
There is a question about the 7.5% rise, but I'll look at them at the end if that's okay, and we'll go through them. We'll make sure we don't miss any questions because they're all important. So I will now try and share the slide. Thanks, Sohrab, for Dave's presentation. So please bear with me while I try and navigate myself around this technology. Here we are. Can everybody see that?
No, I can't see that.
Try again. No. Bear with me. I'm so sorry. It's just I'm not used to doing this. No, that's so bad. Let me close that one. Let me try again. Can you see that now?
No, not yet, Tracy.
No, can't see it.
I'm so sorry. I can see it, but obviously you can't. I'm pressing the shift.
When you got the blank screen with just your initials up, that's looked promising.
Have you tried clicking stop sharing, Tracy, and then start sharing again and clicking the new document? Sometimes you have to stop altogether before it will let you share a new one.
Let me start from absolute scratch. I think I've got too many things open now. Right.
Miriam.
Can you see that?
Yes, we can see that.
Yes, thank you. Sorry about
that's good.
So Dave, sorry about that. Sorry about the delay there. So I'll introduce you now to Dave Gardner, who will talk you through the impacts and what we've been trying to do in response to the impact of COVID-19. Dave, over to you.
Morning, everybody. Is my microphone on? I'm having some.
Yes.
Thank
yes,
you. That's
it
good.
is.
My system's frozen my end, but I'm glad to see that I am transmitting. I see there's a number of people on the line, and this is one of the problems with COVID. I so much want to meet with people that we haven't seen for a while. And we know that as we meet with people, we get good ideas, the networking's important, and we learn things from each other. And one of the things I wanted to say to start with is that we are aware that we need to find new ways of communicating and sharing all that's happening in mental health, because there is a lot that's going on as we go forward. And so we'll gratefully receive feedback from today's session on what you might find helpful as we try to find new ways of engaging, because the large scale events that we've done in the past and other ways of meeting together don't look like they're going to be feasible for us in the next 6 months or so. So that's a recognition from me that we need to find new ways of going forward. Today, I'm only going to touch the surface of some of the things that we've done. There is a significant programme for mental health under something called the NHS Long-Term Plan. But I'm going to focus really on some of those things which are most important in relation to COVID. If we can move to the next slide, which I can't see. Are we on help and advice?
Yes.
Yes.
So the first thing to say is that we have initiated on the Joined Up Care Derbyshire website. That's where you can find most information and support for self-help advice, where you can go for help. It's important that people have that awareness. That's where they can find that information, and that we would ask organisations to make sure they've referenced that within their websites. The significant change has been a 24-hour helpline which has been established. We already had plans in Derbyshire to grow a helpline from small beginnings at the police control room, where we had social care and health working together. But the government asked us to take forward those plans at pace and immediately put in place a 24-hour helpline for all ages. That was put in place by Derbyshire Healthcare. You can see the telephone number there. They mobilised this very quickly using staff that had been shielded, that weren't able to go out and see patients. And we're now in the process of making that substantive, fit for the future. We have P3, a voluntary sector organisation, who will increasingly be the front end of the service and will deal with most of the incoming calls for advice and support, but supported by nurses providing a clinical triage function for those people that need access to secondary NHS care services, an expanded crisis team offer of support to see people in the community. And also, we're setting up a safe haven in Derby City with the Richmond Fellowship, and intend to do the same early next year in Chesterfield. So a number of initiatives, but the helpline 0800 028 0077 is the most significant piece of work in relation to COVID, so people know where they can be directed for help. We're getting good customer feedback on the whole, and we're also finding that we're learning as we go. We found that having some of our psychologists and other counselling staff on that line has enabled things to be resolved at the very beginning for people. So getting the right care quickly is a key message. So I think we can skip the next line, which is the mental health support line, and go on to support for young people, Tracy. Is that showing?
Yes, it's showing, Dave.
Thank you. So for children and young people, we know that they tend not to access helplines. It's their parents that will access helplines. We're finding the number of young people that will phone the helpline to be very small. And whilst we do know that we need to make that more child friendly, and we're putting some investment into that, nevertheless, we know it's not going to be the key way in which young people will look for support. We've introduced in September 2019 something called Couth and something called Quell. Now, Couth is a free digital platform for children they can access on their phones or on their computers. And this was being widely advertised in the schools prior to the COVID lockdown. So we've seen a gradual increase in the use of that facility. Young people are using Couth to get a good source of information and support about mental health. There is counselling available through that service. There's digital support of a whole variety of means, and that's free to anyone in Derbyshire. Quell, it does a similar thing, but for parents. And we found that parents often needed support after office hours, maybe after children have gone to bed, after they've done all the household chores and so on. So we're finding that's been accessed most often at around about 8 o'clock at night. So again, that's proving to be a very helpful piece of technological support. I also want to mention something called Building Sound Minds. Now, this is a service provided by the charity Action for Children. It's commissioned by Derbyshire Clinical Commissioning Group. And this is in recognition that we had lots of feedback to say, my child needs help, they need a therapy, they need some support, they need some counselling, but they may not need the full wraparound support of a care manager and other kinds of support that can be provided by CAMS. And we had a lot of people being referred into our specialist child and adolescent mental health services, which is what CAMS stands for, who really did not need that level of support, but there was nothing else. And not surprisingly, therefore, waiting lists and access times were going up. So Building Sound Minds is a significant investment where people, professionals, teachers can access directly. The waiting times are significantly less. They're going directly into schools. And of course, again, COVID coming along interrupted the whole development of this programme. But they have counsellors, psychologists and support workers who can provide support to young people. And now that the schools are back, we're seeing that those referrals are shooting up for those services. There's something else I want to mention, which is the mental health support teams in schools. Again, this was a new government initiative for which Derbyshire, because of the good partnerships we have, were successful in bidding for some money from the government. And Lady Manners School, in Bakewell, the Ormiston School, the Ilkeston Academy, the Ilkeston, the Bolsover School, all of these schools were having mental health teams being trained to be based in the schools and to work in the schools in those localities. There was kind of networks of schools. This is really important because we know that this is the community that makes most sense to children. This is where you can spot problems earlier, where you can put help in, where we can build resilience and provide support at the right level, whether that be group work, whether it be the counselling, whether it be a whole range of educational inputs. So Building Sound Minds is really quite important. And now the schools are back, we're expecting, again, that programme to become more visible. I've put the website for Building Sound Minds there for you. And again, it's worth reminding people that's available.
Just to let you know why you've paused there, there's about 2 or 3 minutes left.
Okay, thank you. So the other thing to say is we've been very concerned about looked after children. There's been a big increase in the number of looked after children, not specifically because of the coronavirus, but we've seen this nationally. And we were very concerned to get them the right access to trauma-informed services. And people will know that we've done a lot of training in something called ACEs, which is trying to understand how trauma in childhood impacts on the rest of your life and how we should approach people differently from the way perhaps historically we have. And so we've commissioned a trauma-informed service for looked after children. And again, that's now starting and will provide bespoke support for those children. The final thing I need to tell you about is called CAM Specialist Community Advisors, SCARS, some people call them, SCA for short. And this is because we found that professionals don't know, like a teacher or a GP, may not know exactly where the right support should be for a person. There's such a range of support now, and often people don't know where to turn. So the specialist care advisors are there to provide the support, the training to the schools, and to give the advice as to where the best place for a particular child's problem is to be addressed, so we can get people to the right help in the most timely way. So the SCARS are there as that intermediary between the CAM services and these other services I've talked about. So a lot going on. If we move on to communications.
Just to let you know, 2 minutes, Dave, you've got 2 slides.
I'm on there, don't worry. So I'm not going to go into detail for this, but I want you to note the emotional health and wellbeing website that's been set up. We've commissioned Derbyshire County Council to provide this for the whole system. And that's where you can find all the information that you need on all the different services for young people. So that emotional health and wellbeing site, really important. And again, signpost people to it. So what's changed during COVID? Well, we've seen consultant psychiatrist outpatient appointments changing. We've seen more people getting virtual appointments, and we're not sure whether we really want to go back to the old ways of working. And that's a conversation I think we need to have. There was lots of people being seen to review their state who are feeling quite well. There are other people who were not going to outpatients who were very ill and needed to have access to a psychiatrist. And I think what we have seen through the new ways of working during COVID is that there are other ways of making sure we can check on people's health, that they can communicate their needs. But at the same time, we also recognise that relationships are really key to any mental health treatment. And the relationship you have with your therapist is really important. And that can't be completely superseded by what we're doing now, by doing things online. So there's a conversation about that. Psychological therapies have continued to be delivered. Many people have been accessing those telephone and online, and we've had some very good feedback. But again, it doesn't suit everybody. We have seen an increased capacity for children that we've done through Building Sound Minds and through other ranges of people, and more children are being seen now than ever. But again, virtual methods don't suit everyone. Our CAMS teams have been seeing the most ill children directly in clinics or at home when necessary. We have been given, or we've been told we're going to be given, a substantial amount of money next year to improve crisis care for young people. And that's one of the things we want to engage with going forward. We want to get to a situation where we can provide for children in the community same-day support, and the government's target is within 4 hours support. So that's something that we need to develop. I'm going to really jump forward to the what next, really. Crisis alternatives are coming up. I've mentioned safe havens. We expect a safe haven to be started in the city in November, which is an alternative to attending accident and emergency. That will be accessed through the helpline. We have started a conversation around integrated primary and community care, because there's something called the Community Mental Health Framework. This is really a big subject in its own right, but we want to try and develop localized services based on the local geography, local needs, and the issues that are really pertinent in a particular area, which has far less demarcation lines between mental health, substance misuse, and so on, and focuses more on need. So that piece of work has been taken forward by Tracy, and perhaps we're happy to take questions on that. Finally, my last point really is, in this context of difficult financial times, the CCG has maintained a commitment to increase its funding on mental health. It's gone up this year, last year, the year before, and we have committed to continue to invest in mental health. So there will be a lot more initiatives coming forward, and we need to find new ways of engage to have conversations about these things. I think I'll finish there and give a chance for conversations.
Thank you, Dave. I'm just going to, if that's all right with everybody, I'm just going to go down the chat box now to give an opportunity. Katie, just remind me, how much time have we got left to go through the questions in the chat box? Is Katie there?
You've got just under half an hour, Tracy, to answer the questions.
Right, okay, so I'll go through the questions then. So this one from Andrew, I think this was for Sohrab. Sohrab, to what figure will the 7.5% rise to when allowance is made for economic downturn and job loss? 10%, 20% or more?
Well, it's a very good question, thank you. Can you hear me?
Yes, we can hear you.
I don't know. The short answer is I don't. The short answer is I don't. Okay, I've got an echo. I'm going to have to do something now. What have I done wrong here? Let's turn this off. Right. Perhaps I was on twice or something. Can you hear me okay without an echo?
Yes, we can.
Thank you. Right. So clearly the answer is higher than 7.5% for sure. And it depends. It depends on things like the furlough scheme, and it depends on how much unemployment there is or how much financial hardship there is going to be, because the two are very strongly linked, obviously. Sadly, there is going to be some. The actual answer, we don't know. It depends on the government and what they do, and to some extent how unwell. Sorry, not how unwell, how much we're affected by COVID over the winter, because it's not gone yet. So, a short answer, we don't know.
Tracy, if I could come back a little bit on that answer. We have produced a paper based on all the evidence, and I think as part of our sharing from today, we'll share that paper, which gives you the answers to the sort of numbers of people that we think are in these different groups, and perhaps gives you a bit more of an answer that you're looking for in terms of the potential impact for employment. So I think if we share it there, that might be the best thing to do. It's a public document, happy to share it.
Thank you both. The next question, I think I'll probably direct to you, Dave, from Claire, about people getting some contact from services during lockdown. So during lockdown, I had to use the outpatient free phone helpline. I just wondered, for people who are registered with outpatient mental health services, maybe it would have been good to have had a call to the mental health nurse every few weeks to check on their mental health.
Yes, I think we would agree. Yeah. I know for children, we had ensured that we had risk assessed all the cases that were known, all the people that were known to the teams. They had given like a traffic light system for those that needed to have very regular contact, and those people that could have less frequent contact, trying to manage that, and those that needed to be seen in person. A similar exercise was undertaken by the community mental health teams, and they were trying to make sure that people did receive some contact, but we have had some feedback that not everybody did. But I think what you're saying was the intention, that people did at least get some check calls to see how they were doing. I believe it's getting better now that we have more staff back. In the early days, there were a lot of staff off, unwell. That seems to have improved, but I think I think it's right that we need to make sure people have at least some form of contact. And we'll pass that message on to Derbyshire Healthcare. I think that's important feedback.
Yeah, thanks, Dave. And also I've noticed, Sohrab, you also commented a response as well. Did you want to elaborate on that, or people have had an opportunity to see your...
Yeah, I can't find it now. What did I say? I've forgotten.
Thank you, sir. So GP practices have all reached out to their patients with severe mental health problems with text messages offering support, and the psychiatrists have rung the patients they have under their care to check in on them. Your idea of a call every 3 weeks is a good one.
Yes, I think that the capacity within the community mental health, the Derbyshire Mental Health Trust for being able to do everything perfectly, we have to recognise, I don't know if Dave mentioned this, but there was a time when they had 200 of their staff off sick or in isolation. That's 200 mental health nurses unable to do their jobs at one point. So clearly, if it hadn't affected the workforce, it would have been a better response than it was. But yes, I think the idea of a regular call to people who are who are severely mentally unwell is a very, very good one.
And I think as we think about new ways for doing outpatients, finding ways to keep in touch with people in an effective way, this is the kind of thing we need to think about, and offer appointments for those that need them, and to be able to check on those people, just to check that people are okay and they're still doing all right. So how we get that balance of being proactive in care and offering appointments is something that we are going to have to all have a discussion about. I don't think it can ever go back to how it was if we want to care for those people who have become really quite unwell, and the increase in those people who've got severe illness. We've got to find new ways of doing things.
Thank you both. I'll just move on to the next question, and I'll direct this to you, Dave, if that's all right. What has been the impact of COVID-19 on numbers of frequent users of emergency services, particularly A&E?
In the early days, we had a big drop in the number of people who attended A&E, and that was really helpful. The public really responded very positively so that our ED departments could concentrate on those people who were most unwell and genuine emergencies. There's been a concern for a long time that ED departments have not been used for emergency care, but have been the sort of almost first point of call for people with a range of concerns. It's partly why we have set up the safe havens, so that those people with mental health problems who would need some good social support can go somewhere else. That's part of that response for the future. I have to say that now the number of people going to ED with non-emergency problems has risen, and we are concerned about how we manage both winter pressures, particularly the number of older people becoming unwell with the normal things that happen this time of year, and with COVID. So I think there has been a change in behaviour again. People are reverting to what they used to do, and that is of concern to us.
Thanks, Dave. I noticed that Sohrab, you also responded to that in the chat box as well. I don't know if you want to add anything to what Dave's just said. You're on mute, Sohrab.
Just to basically echo what Dave said, really. I think the same thing. Yeah, basically the numbers went down and now they're coming back up. I do not think that the reason why people do not go to A&E is because they are not. I'm talking about the people with mental illness, because they've got better. Clearly, we know it's not that. So some people have not been seeking any help, and we have to find other ways of making the care accessible. So we have let people know that their GP is available. They can contact the GP. And as I said to you a bit earlier on, the number of people I see in a surgery now with mental illness or mental concerns is at least double what it used to be. So we are accessible as in general practice. Oh, and also we've got this new helpline, which Dave mentioned earlier, didn't you, Dave? which is anybody can pick up the phone and ring this free helpline in Derbyshire now and say if they've got a concern and be helped or directed to the right place. So that's getting a lot of calls, which otherwise would have potentially people would have gone to A&E.
Okay, thanks, Sohrab. We have another query. Has the change of responder made a discernible difference to outcomes for people with mental health issues? I'm not sure I understand the change of responder. Do we mean a change of key worker, maybe? Somebody other than the key worker responding?
I think what we're saying here is the fact that people aren't accessing the care in the same way, like A&E or whatever. If they're having to go somewhere else or they're having to get help from somewhere else, is this affecting the outcomes? So the real question here is what's happening to the overall mental health of our population during this time? Now we know that there is more mental illness or more mental concern in the whole population, and we know that's particularly bad in people with pre-existing mental health problems. So in terms of accessing care, we know, having done a survey on our patients with severe mental illness recently, that they have been frustrated in being able to get the right level of care and having to use online services. So yes, it has had an impact. In terms of outcome, I couldn't give you, we could research that and we could find out exactly what kind of figures we have, but the soft answer is definitely there's been an impact on quality of care or access to care. Having said that, the survey we did showed that a lot of patients were very pleased with the extra care that they were getting from general practice during the time when they couldn't access their normal services. So it just depends on where you are and how easy it was at that point. But we can look into that and get some figures if we can.
If I can add to that, the survey, and I think Nikki's on the line who took the survey, but we saw some people finding it very helpful to have a digital offering. We found some of the people particularly with autism, found it really helpful to have that structured approach and to be able to do this from home, from their computer. We found some people who are in work have found it easier to be able to manage appointments virtually. So there isn't a one size fits all for this. We do know that people do need to have personal contact, reality checking, and extra help. I think the thing that has struck us with COVID is that there has been a big increase in the number of people with severe mental illness that we didn't know at all. There's been a 40% increase in the number of people who have been compulsorily detained over the course of the last year. And many of those people were people we didn't know. So clearly, when we talk about the impacts of COVID, while this is relatively small numbers of people, it's been a big rise for those people with the trigger factors for severe mental illness, and that's been coming to the fore. But some of the reasons why people have been becoming unwell are not to do with the absence of psychiatric help. It's because some of their protective factors, their friendships, their support, their normal ways of managing have been reduced.
Okay, thanks. We've had another observation around virtual meetings from Jocelyn, that friends have preferred that, and Sohrab has responded to that. I think it's good. It's good that we have a choice, and I think choice is key in this one. That people have a choice of face-to-face or virtual. Extra money from the government, does that? I'm assuming, unless I've missed something further up, that the additional money, is that the question, that the additional money we're getting into the system will come from the government?
I can answer that one. I think the government have given the whole health community some resources to help respond to COVID. So where we've put in increased services, we've been able to claim some of that money back from the government to date. But there is also money that's been promised to us as part of the mental health strategy, the NHS strategy, and we've seen some monies coming through that way. But the helpline has cost an enormous amount of money, and that's so far we've been able to do a mixture of claiming our additional costs back and reorganising the budgets we already have. Because clearly, if we had staff who weren't doing one thing, they could have been on the helpline. So we weren't able to. You can't claim twice, but the additional costs have been claimed for. But the bringing forward of a helpline 24/7 and some of these other things have impacted on our planning, and so we're having to give priorities to some of the urgent care areas of work going forward into next year than some of the other things that we also wanted to do. So we're having to make difficult choices, and I think COVID has pushed us towards saying we need to improve the urgent care. Many people would say that that's something that's overdue. We've had feedback for many years through the Crisis Concordat that we needed to improve coordination for urgent care for mental health. So I kind of welcome it, but I don't think we can presume that we are going to get ongoing funding in the way that we have done. And we are concerned how we are going to manage all the different expectations on us in the years ahead. I personally feel we're now at a crossroads where we can't do all the things that we've been asked to do with the resources that we have. We will be able to make improvements. Mental health will have more funding, but whether we can do everything, that's the tension that we're trying to work through.
Okay, just moving on. Thanks, Dave. There's an observation here about what happened to people's mental health during other kind of pandemics like Spanish flu. I know we did use previous pandemics, flu type situations in the past to try and help us with the with COVID-19. But Dave, do you just want to elaborate on that one?
Yes. The work which we'll share was based on looking at all the different pandemics that's happened insofar as we have information. And of course, information was different in previous pandemics. We have looked at a range of sources, and then we've extrapolated that information for the Derbyshire population. So you'll see when you look at that it really does answer these kind of questions for you in terms of why we're saying 7.5% as a global figure. But you will see when you get the piece of work that it breaks down how many people are going to need bereavement support. An awful lot of people are going to need just general social support and resilience building. And then there is a smaller number of people who are going to need the secondary care increased support. So 7.5% is a global figure, but you need to break it down into the individual groups to understand it.
Thanks, Dave. And another question now, it's good to hear about the safe havens. What other policies are in place to address issues that drive frequent use of emergency responses? I think you may have answered some of this already, but if you just want to give an overview of the crisis response work that's happening.
So we've talked about having a helpline as a coordination point. The crisis offer for where the crisis teams go out to see people is changing. And if COVID hadn't happened, you would have seen that there would have been a faster response rate for people being seen in the community directly. We've substantially increased the crisis and home treatment teams and changed the thresholds of care so that they would be able, when we're not in the same COVID restrictions, to be able to see people if the helpline says, well, this person really does need to be seen today. So there's going to be a much faster response. Now, that would also mean that we can perhaps divert some of those people who go to casualty as their first point, because there is an alternative offer. For those people who frequently go to casualty, and there are not many, but those people that frequently do, you often need to take a more bespoke approach of looking at what their particular issues are. And there has been a project run between the police and the Derbyshire Healthcare around looking at those people who are frequently have police involvement and use of the 136 part of the Mental Health Act, which is the police powers to detain. And there we're seeing that you need to have more of a developmental response to look at the person in the round and to try and support the person in a different way. And that's proving to work very well where it's been tried elsewhere in the country. So I think there is a slightly different response for those people who are frequent attenders required from those people who have intermittent crises.
Thanks, Dave. I'm just conscious of time. We've got 3 or 4 more questions, so we can keep the answers succinct. That would be really helpful. So let me just scroll down. It was one about, an acknowledgement about, this is from John, the idea of GP practices checking on patients is a good one, but the time issue is a serious one. Sohrab, can GPs get financial support to implement these very good ideas?
I think from April, next year, there will be some additional funding going to primary care networks for mental health. So potentially yes, but it will be up to the answer is yes, but it will be up to the primary care networks to decide how they use that money. In other words, whether they employ a mental health worker or a social prescriber or something different. So yeah, it depends where you live, how it's spent, but there is a little bit more money coming towards primary care.
And you mentioned social prescribers, and somebody's asked, is it worth looking at how social prescribers could support the PCNs around supporting a proactive approach? And yes, I think the answer to that is
the answer to that is it's already happening in some places, and the answer is definite yes for the future as well.
Yeah, thank you, Sohrab. The trend, so this is from John, the trend back to use of EDs for non-emergency use suggests that the problem has not gone away. Prevention is key here, but requires resource input. Dave?
Yes, I totally agree. And this is part of the tension I talked about, that we're needing to address the urgent care side of things. But really, we want to stop people getting into crisis in the first place. And that's where the work of the integrated care networks and the work of looking at how we can improve and provide better support at that for practices and in the community. So I'm including the third sector in that. That's really important. And we've often found people aren't aware of what's already there for them, and they're not linked in, and they don't have the support to link in. So one of the things we're doing with the helpline, the reason why we have a voluntary sector front end to that, is that we can get people put back into local sources of support, which is where they can build resilience, which helps to provide the support they need not to be in crisis again. So absolutely, I think we need to be looking at prevention in the sense of building that community resilience and support at primary care level, community care level. And normally I perhaps would direct that conversation to you, Tracy, as you lead some of the work that we're doing on just these issues, both in a pilot in Derby City and in High Peak.
Yes, definitely. I won't spend too much time on it, but we're definitely looking at how we can work at much more localised level, working with people who are not only receiving services but delivering support as well. So yeah, there's a big piece of work coming up around how we use our resources in a much better way. Okay, I think we're on the final point now from John, which is a good point about our PPG is involved in a localised action plan with Derbyshire County Council to address suicide prevention. It is proposed that the PPG takes ownership of the programme for sustainability purposes. Sohrab, I don't know if you want to comment on that. That sounds brilliant.
Well, I think this sounds like a positive thing. As I said earlier, suicide prevention is everybody's business. Most people are not under the mental health services, and at the time when this happens, and so it's really about what's happening in the community, and also primary care is an ideal place to have a sort of group of like-minded individuals who are working together with the community to look at bringing together all the aspects of suicide prevention. Training people in the community, in the local shops or whatever, and talking to the practice, because the practice will become educated through that, and then of course linking up with the mental health services when necessary. So I think it's brilliant. I'd love to hear more about it. Do email me.
Thank you, and I think that's all. I apologise if I've missed anything, but I think that's all the points in the chat box. So thank you. Oh, I just think there's one there. There's a lot of lived experience. There's a lot of lived experience led support within the community as well. Absolutely, absolutely, and we need that lived experience to help inform and design different ways of developing pathways for people. So absolutely, and we will be doing a lot more engagement with people with lived experience and communities to help us design a as part of the community mental health framework, very joined up ways of working, which we've got some way to go. I think you would agree with that. Thank you. Katie, over to you.
Thank you. Could I just thank Tracy and Dave and Sohrab for taking time out of their day to come and join this session, and just to say, as I mentioned, it is one part of an ongoing process, because we can't go out to you as we may have done in the past. We are having to look at new ways of working, just in terms of keeping a dialogue open with our residents in Derby and Derbyshire. So this is the start of that process. The next conversation, which is next Wednesday, will be facilitated by 2 GPs, and it's just talking about the primary care or GP response during the COVID pandemic and moving forwards. So I'd like to thank you all for joining today. I hope you've enjoyed it. If there are any further questions, please do put them in the chat box. We do send out to everybody who joined today a copy of the slides and an evaluation form. If there are any other topics that you really think that people would be interested in hearing about, then please do tell us about that, and we can look to putting a session on around those particular areas. So thank you very much, Tracy, Sohrab and Dave, for facilitating the session today, and thank you to everybody who joined. And I am sorry that we have to ask for microphones to be muted and for videos to be off, but it is just to make sure that we can have the signer visible and the presenters visible. So we look forward to seeing you again on one of our other sessions. Thank you very much.
It's been a pleasure. Thank you very much, everyone.
Thank you. I've enjoyed it. It's been really informative.
Pleasure.
Just to say a visible thank you to everyone.
Thank you.
Thank you, Jocelyn. Thanks, everyone.
Bye.
Bye. Thank you. Hopefully see you soon.
Yes, hopefully see you soon. Probably in the flesh, perhaps.
Oh, if not, see you virtually. And
Yes.
thank you for attending.
Okay, take care. Bye.
Take care, Jocelyn and everyone. Thank you.
Hi, Dave. There's another question come up from Anne Melbourne. Shall we respond to that through when we send the notes out to everyone? Shall we go out of this meeting invite and come back in?
Or Dave, I think you're on mute. I know sometimes yours delays a little bit when you unmute yourself, doesn't it?
What are we doing? Sorry, am I confused now?
No.
We were just asking if Anne's question needs to be picked up and circulated with the notes, because Anne's just added another question to the chat box.
Sorry, I missed that. What was the question?
No, it's okay. It was just added in at the end, but we can always get back to Anne separately if that's best, because I think Dave and Sohrab have left.
Yeah, and only Dave would know that one, I think, to be honest.
Anne, I know you're still on the call, just to say that we will get a response to that question, and it will be on the website when we type up the notes.
Hi, am I back?
Yes.
Oh yes,
Dave.
Yes.
I don't know what happened. I lost everything. So I could hear, but I couldn't see the controls or anything. But I'm back now. I've turned video off. I think that's helping.
Oh, no problem. Thank you.
Sorry for the overly technical responses. Good hint there, Tracy. Keep it simple. Very professional.
We're just saying, Anne's still on the call and she's asked a question in the chat box, but
Oh, yes.
we're happy to pick that up with you separately and send a response out with the notes. If
yes.
like
What I couldn't tell was what was Anne's question.
Is the Heritage School in Clown involved in the Building Sound Minds?
Yes, Building Sound Minds is available to all the schools in Derbyshire and Derbyshire. And if that school has not got themselves involved with them, then there's nothing to stop them. It's a completely open offer. They had, prior to COVID, been going around doing road shows, going to schools, introducing themselves, as had the Couth team been doing the same thing to make themselves aware. So I can't, off the top of my head, know how much that school's been involved with them, but most schools have been making referrals. I can't answer specifically for that one, but there's no reason why they shouldn't. And we have encouraged through Derbyshire County Council and through the schools networks, through the SEND networks, that they're aware of the opportunity to get the help.
Has that answered your question, Anne? Is that? We're going to shut this meeting down now.